Hey, it's Chris with ROE Dental Laboratory, and I want to introduce you this nice little book we put together. It is the Ultimate Restorative Protocol Guide. Now, this guide has all the different workflows, analog and digital, on how to get to your final restoration on a full arch case. And it also has different patient scenarios. So depending on how they walk into your office, how they present. These full arch cases can be tough, and that's why we put a whole book together to kind of help you out with that. But this is going to get you started. One thing we're going to cover today is the freehand denture conversion method. Now, again, this is gonna take some work. If you have a lab tech around, great, have them come and do this workflow for you, makes your life a lot easier. But I'm going to step you through this. We do have all the steps listed and the materials needed to make this happen. The main thing is, of course, they need a denture. Assuming they're in a healing denture, now this can be converted. You do want to make sure that the healing denture is strong enough that you can convert it and then to a fixed, and then the patient can wear that, and then you can get some more records back to the lab for their printed try-in phase. But some things you're going to need. Now, the patient's in your office, they're on multi-unit abutments, and the healing caps are over those multi-unit abutments. You're going to want to order some temporary cylinders. You need some acrylic to do the pickup, some reline material, which you probably have in your office. And that's, as far as materials, that's probably it. Again, everything's listed in here. Patient comes in, you'll take some photos for us, please, while they're wearing that denture, a nice full face, full smile photo. And then we are going to reline that denture, and then we'll let that reline material set, get them in a nice bite. Material sets, now you know where each of the multi-units are. You're going to drill out some holes in those where the multi-units are. So drill some holes through the denture, and then you're going to seat temporary cylinders. You can probably maybe see that right here. But you'll seat the temporary cylinders. Again, it's all in the book. Seat the temporary cylinders, and then you're going to pick those up in the denture. Now, you want to put a rubber dam down before you do all this. Again, all listed here. But you're going to want to pick those temporary cylinders up in the denture. Then you're going to backfill it with some acrylic. You're going to have to cut that denture back and remove the pallet. Any cantilevers, you want to get rid of those because you don't want this denture breaking. And then you're going to really just make sure everything sets up, clean it up nice and pretty, get it ready for delivery, and now you can deliver this back onto the multi-unit abutment so you have a fixed or prosthesis. I know I kind of ran through that pretty quickly. It is a longer appointment to do this. I would say hour and a half appointment to do this denture conversion. And then from there, we have different workflows to choose from to get to your printed try-in and file to get those records back to the lab. So again, this book has it covered. Some nice lab work to go along with this denture conversion, but it's just another route to that final. Again, all the different methods are listed in this book. So it's something you can get online. Any questions, give us a call here at the lab. Please follow us on all of our socials, and we look forward to working with you on your next full arch case. Thank you.